The pediatrician of today and tomorrow will have to be a real specialist. You'll have to do two things: preventive care really well, and B, step up and manage chronic disease, just like we did with asthma. But we're going to have to do it with autism. We're going to have to do it with metabolic syndrome, obesity, type 2 diabetes. We're going to have to send less to the subspecialist so that they have the bandwidth to take care of the. So I'll give you an example. I'm okay managing a type 2 diabetic as long as I can keep him under a hemoglobin A1C of 7 on metformin, and I can get him to lose some weight. But if I can't do that, then that kid failed what a specialist should do. Now I want a subspecialist to help me figure out, do I have the wrong diagnosis? Should I be more aggressive? Should I start GLP-1? What else can I offer this kid so that he doesn't stroke when he's 30? But we're going to have to step up. We're going to have to ramp up reach-like programs. We're going to have to ramp up echo sessions where we sit down with subspecialists and people have an interest in that disease, and we discuss cases and we build up our confidence to take care of these kids and get paid for taking care of these kids.
And we need to do that without losing sight of the acute care, because some kid is still going to come into the office with meningitis or appendicitis, and we still need to be aware of that as well when we're focusing on the chronic disease. But we have to, I agree with you, the primary care doc has to take on more to relieve the burden from the subspecialist. The question is when they're going to have time to do that.
Right.
Amidst everything else. And again, it goes back to the workforce. If we don't have more primary care pediatricians, there are just so many patients any of us can see in a day. And if we don't attract more people to pediatrics as a career, which again goes back to the payment levels and the financial rewards, we're not going to be able to serve the patients in whatever field, whether it's the chronic disease type 2 diabetes management, or whether it's the acute care or being there for the preventive care. We're just not going to be able to serve them. So it again goes back to the entire workforce issue. And that's the reason for my focus where it is in the academy at this point.
Thank you.
Thank you for doing all the work that you do and all the work that you have done throughout the years at the academy. You're a true leader amongst us. And
it has been a pleasure. It has been rewarding, and it continues to be so. I hope to continue doing it for a long time.
We'll see you in Orlando and we'll take a picture.
Absolutely.
We'll do a selfie.
Looking forward to it.
Thank you. It's always a joy to talk to you.
You as well, guys. Good to see you.